Good evening, friends. This is Dr.Manjunath, veterinary consultant, urologist, and andrologist at Raichur. Today, I'll be talking about most common disease that we see in clinical practice of urology: urinary tract infections, UTI. So, patients come to my clinic with such huge files saying they have repeated urinary tract infections. So, we have to understand three important things. One is urinary tract infection, recurrent UTIs, and persistent urinary tract infections. So any patient with symptoms of frequency of passing urination, burning sensation or dysuria we call, sometimes even pain, fever, lower abdominal pain, and we see patients landing up in hypotension with sepsis, urosepsis. All these are part of UTI, symptoms of UTI. So when they come to us, we ask three simple tests to them. One is urine routine microscopy, which will tell us the number of pus cells, any blood in the urine, or any bacteria in the urine. Second important thing is urine culture, which will tell us what kind of bacteria is causing the urinary tract infection and the appropriate antibiotic to it. Third important thing we ask is ultrasound to rule out any abnormalities like stone, any urological anomalies. To screen that, we ask for these three simple tests. So after doing that, most of the times we prescribe them the antibiotic course of therapy. So after the patient is cured, suppose patient is having symptoms again in the span of like 2 episodes in 6 months or thrice in a year, we call it recurrent UTI. So this needs to be evaluated very clearly and thoughtfully by an experienced urologist. We have to rule out many other factors where patient may not be able to empty the bladder, some stones, some kind of anomalies which diabetes. So we have to, urologists will know how to evaluate the case of recurrent UTIs. Third entity we call it as persistent UTI, means patient has been treated but still patient continues to have the same organism of causing UTI. That is persistent UTI, meaning patient will have same organism, maybe undertreated cases. Suppose we usually prescribe for 14 to sometimes 1 month also antibiotic course depending on the severity. Suppose patient has taken 3 or 5 days of antibiotics and is relieved of symptoms, but bacteria continues to be there. This is called persistent urinary tract infection. All these cases have to be evaluated thoroughly by an experienced urologist. Please consult your urologist for the above complaints. Thank you.